Hi, this is Eric Lloyd, Master's Student in Clinical Psychology. I wanted to just read some of this here from discoveries.childrenshospital.org. It's from Boston Children's. It's talking about the COVID-19 virus in children. It says COVID-19 and a serious inflammatory syndrome in children, unpacking recent warnings. This was posted May 8th, 2020, so 8 days ago, by Nancy Fleisler, Clinical Care Specialty Care. I'm going to put up a link to the website as well. On April 27th, an alert circulated from the UK about multi-symptom inflammatory disease in children with COVID-19, based on a small rise in the number of critically ill children with this illness in England. Picked up by multiple media outlets, the alert cited features of toxic shock syndrome and incomplete Kawasaki disease, with some children experiencing gastrointestinal symptoms and cardiac inflammation. The New York City Health Department soon followed with its own alert. The emerging syndrome is now being called pediatric multi-symptom inflammatory syndrome. Pediatric multi-symptom inflammatory syndrome. On May 2nd, the International PICU COVID-19 collaboration, coordinated by Jeffrey Burns, MD, MPH, Chief of Critical Care Medicine at Boston Children's Hospital, convened at a Zoom conference to compare notes. Pediatric experts in intensive care, cardiology, rheumatology, infectious disease, and Kawasaki disease reviewed data from several dozen cases in Europe and the US, offered guidance for clinicians, and laid out an agenda for research. Key take-homes. Two things are clear about this still mysterious pattern of illness. First, thus far it is rare. But second, clinicians who suspect a case should consult promptly with pediatric infectious disease, rheumatology, or critical care specialists. Because some children get sicker rapidly, they should be cared for in hospitals with tertiary pediatric cardiac intensive care units. Their cases should be discussed with pediatric specialists in infectious disease, rheumatology, and cardiology to anticipate and manage aspects of the illness. COVID inflammation in children, an emerging picture. During the May 2nd conference, panelists described a syndrome temporarily associated with COVID-19, marked by persistent fear, inflammation, poor function in one or more organs, and other specific clinical and laboratory features not attributable to other infections. See case definition. Many affected children were hospitalized, and some require intensive care due to a clinical picture consistent with shock. Pediatric multi-symptom inflammatory syndrome potentially associated with COVID-19. I know they were speaking about this on CNN the other day, about a child who thankfully recovered from it. Case definition. To promote awareness and facilitate worldwide research collaborations, the panel suggests all clinicians adopt the following case definition, put forth by the Royal College of Pediatrics and Child Health. A child presenting with persistent fear, inflammation, defined as neutrophilia, elevated CRP, and lymphopenia, and evidence of single or multi-organ dysfunction, shock, cardiac, respiratory, renal, gastrointestinal, or neurological disorder with additional features. The child may fulfill full or partial criteria for Kawasaki disease. Number 2, exclusion of any other microbial cause, including bacterial sepsis, staphylococcal or streptococcal shock syndromes, infections associated with myocarditis, such as enterovirus. However, waiting for results of these investigations should not delay seeking expert advice. SARS-CoV-2 PCR testing may be positive or negative. For more information, https://www.rcp.ac.uk/sites/default/files/2020-05/COVID-19 pediatric multi-symptom %20 inflammatory 20% syndrome. I'll upload the link as well. Some children presented with some or all features seen in Kawasaki disease, an illness of children that can result in enlargement or aneurysms of the coronary arteries. Features observed include fever, rash, conjunctivitis, red swollen hands, and red cracked lips. Some children had clinical and laboratory signs of cytokine storm syndrome, an exaggerated systemic immune response that has caused organ damage in adults with COVID-19. Finally, many children had coagulopathies, cardiac dysfunction, diarrhea, abdominal dissension, and other GI symptoms, with some children having positive stool tests for SARS-CoV-2 or acute kidney injury. Respiratory syndromes were not always a prominent feature. We could be dealing with several phenotypes on a spectrum. Phenotypes are the expressed parts of the genotype, genetic code, what's expressed. Says Boston Children's Hospital rheumatologist Mary Beth Sun, MD, who was one of the conference panelists. In some cases, children present with shock, and some have features of Kawasaki disease, whereas others may present with signs of cytokine storm. In some geographic areas, there has been an uptick in Kawasaki disease cases in children who don't have shock. The U.S. cases to date have been mainly in East Coast cities, with some in the Midwest and South. Of course, an uptick has not yet been observed on the West Coast or in Japan and Korea, where a different strain of SARS-CoV-2 is believed to predominate. To date, most children affected have done well. Treatments have included anticoagulation, IV immunoglobulin, IL-1 or IL-6 blockade, and corticosteroids. Some children have only needed supportive care. Why are cases of COVID-related inflammation emerging now? Of note, not all children with this inflammatory syndrome tested positive for COVID-19. PCR testing for SARS-CoV-2 was often negative, and tests for antibodies were sometimes, but not always, positive. While the tests themselves may have had varied accuracy, the fact that PCR negative patients sometimes positive for antibodies suggests that inflammatory complications were delayed, occurring when the virus was no longer detectable on nasal swabs. We have these clusters of illnesses where they can't say it's caused by COVID, but clearly it's temporarily related, says Sun. Why these cases are emerging only now and what's causing them is still a mystery. Panelists speculated that an acquired immune response to COVID activates an inflammatory response in genetically susceptible children, but other mechanisms are possible as well. If you look at the curves, COVID-19 has plateaued, but there is an exponential rise in this secondary type of shock syndrome, says cardiologist Jane Newberger, MD, MPH, an international expert on Kawasaki disease who was also on the May 2nd panel. It is even possible that the antibodies that children are making to SARS-CoV-2 are creating an immune reaction in the body? Nobody knows. The clinical workup of children with COVID-related inflammation. In its consensus statement, the International Pediatric ICU Panel, PICU, offered the following guidance for clinicians encountering potential cases of this COVID-related syndrome in children. Follow-up. While not all may become severely ill, children with unexplained fever and evidence of inflammation, elevated C-reactive protein or white blood cell count should be carefully followed to detect potential progression of disease. Laboratory tests. Evaluations should include measurement of sequential inflammatory markers, including complete blood count differential C-reactive protein, erythrocyte sedimentation rate, coagulation parameters including D-dimer and ferritin, liver function markers, and a cytokine panel. Children should have antibody testing in addition to PCR testing for SARS-CoV-2, since many children are antibody positive when PCR negative. Echocardiography. Children with this syndrome should have several echocardiograms, including detailed assessments of the coronary arteries. Many to date have been found to have low heart function, and some have enlargement of the coronary arteries. Children with serious cardiac complications should be followed longer term. A call for more research. The panelists pointed to an urgent need to better understand this emerging COVID-associated illness pattern in children, how children's immune systems are responding, what genetic risk factors they may carry, and why there is a range of presentations. They urge clinicians to enroll children in research protocols that include obtaining serum or plasma samples, DNA and RNA studies for biobanking. They also call on government and other health agencies to invest immediately in clinical trials, as well as data integration drawing on registries of children with COVID-19 and children with the new inflammatory syndrome. The best evidence to date from the CDC and this international collaboration is that children rarely become critically ill from COVID-19 or from this pediatric multi-symptom inflammatory syndrome, says Burns. Our major objective is to alert clinicians to this clinical presentation to ensure that these children get treated by pediatric specialists who pursue the appropriate clinical workup, and to see that they are enrolled in integrated data registries and clinical trials that will promote evidence-based care and a better understanding of this disorder. More on Boston Children's response to COVID-19 and COVID-19 research at the hospital. I'm going to go ahead and share this as well. I don't want to take up too much time, but this clears up a little bit of what's going on for children that are affected by the COVID-19 and this multi-symptom inflammatory syndrome as well. I hope this helps. Thank you. Bye-bye.